طيب الحمد لله والصلاة والسلام على رسول الله ما بعد. إن شاء الله we'll start نواقض الوضوء. نواقض الوضوء. The things that nullify the wudu. We studied what are the conditions of wudu, the perfect wudu, mustahab wudu. So now these things will invalidate your wudu. Validate your wudu. نواقض الوضوء. Number one, خروج البول أو الغائط أو الريح من السبيلين. When the urine, the stool or the wind come out from السبيلين. السبيلين means the two exits. The exit of urine and the exit of your stool. Okay? This is إجماع, consensus by the scholars, will invalidate your wudu. طيب. And he mentioned السبيلين, the two exits. Okay, because there is a different issue if these things come out from unusual exit. Is it possible? Is it possible the urine comes out from unusual exit? Yes. No, it is, subhanAllah, we can't imagine this. It may be before difficult to imagine this, or very rare, but now it is common. When they do, for example, operation, okay, they stop the normal exit and they open another exit from the side. For example, for urine, subhanAllah, the cancer patients. Okay, when they remove the colon, okay, they open for the stool another exit. Alaykum salam. So we will come to this point. But now, ijma', consensus that from the normal exits will invalidate, the urine, the wind, the stool from the normal exit will invalidate your wudu, will invalidate your wudu. Sorry?
Blood, for example, out of the normal exits.
From the normal exit will invalidate. Yes, will invalidate. Yes, will invalidate the wudu. Will invalidate wudu, the blood. طيب. Then he said, and what about these things if they come out from unusual, not from the anus and not from the opening of urine? طيب. For example, Abu Hanifa, Thawri, Ahmed, Ibn Hazm, they say this will also invalidate the wudu. This will invalidate your wudu. If the najasa, if the filth comes out from the unusual exit, also will invalidate the wudu. طيب. والشافعي رحمه الله said ينقض إذا خرج منهما ولو لم يكن نجسا كالحصاء ونحوه. طيب. الشافعي said this will invalidate Shafi'i said even the things which are not najis, if they come out from both exits, will invalidate the wudu. For example, if a stone comes out from the anus, or a kind of disease, the worm will come out from maybe kinds of diseases, okay, they will come out from the anus. Also this will invalidate. It is not najis, maybe it is not najis, maybe for example the baby, the coin or something, or stone, it is not najis, but it will invalidate the wudu. It will invalidate the wudu. طيب. They mention a point, the wind, if the wind comes out from the front, especially for the ladies, will this invalidate the wudu or not? They say, subhanAllah, sometimes there is a problem, a medical problem. There will be an opening from the from the normal passage of the wind to abnormal opening, to the urine opening. Okay, then they say this will invalidate the wudu. This will invalidate the wudu. Why? Because they say this is a wind. It normally it goes out from the anus, but because there is a medical problem, which is called fistula. Fistula means abnormal opening. So it will come out also from the front. This will also invalidate the wudu. But for the woman, if it is gases, يعني a kind of gases, a kind of gas, which comes out from the vagina of the woman, and it doesn't have the criteria of wind, then it will not invalidate. طيب يعني they mean for the woman some يعني some issue like also a discharge which comes from the woman, from the vagina. They say, will this invalidate the wudu or not? They say, if it is like a sweating, يعني there's a kind of discharge like a sweating. Okay? So this will not invalidate the wudu, and also it is not najis. And the same thing, this kind of air or of gas, if it comes from the front side of the woman, will not invalidate the wudu. Will not invalidate the wudu. Why? Because it is not a wind from the colon. It is not from the stomach and the colon. It doesn't have the criteria of the wind, which with the same smell, the bad smell. So it will not take its ruling. It will not take its ruling. So this wind which comes out from the woman, usually, if it has the criteria of the normal wind, then this will invalidate the wudu. Why? Because it comes from the colon. But because the medical problem, so it comes out from front and back, or back. Then this will invalidate the wudu. But if this is only from the womb and vagina, and it doesn't have the criteria of the wind, the smell, then it will not invalidate the wudu, and the same thing, the discharge. Number 2, al-wadi wal-madi. Al-wadi wal-madi. If you remember, we mentioned that there's something called madi, comes out from the man. This is najis, صح? We mentioned this is najis. Do you remember madi? Yes. This madi comes when the man, for example, talks with his wife, maybe hugging, kissing. It is not many, it is not semen. It is very fine and light liquid, a kind of discharge from the man, normal. This is not abnormality. And this is najis. And this also will invalidate the wudu. Why? Because the hadith, Ali radiallahu ta'ala an, he said, كنت رجلا مداءً. The madi comes from me a lot, frequently. What should I do? The Prophet ﷺ said, توضأ وانضح فرجك. Make wudu and وانضح فرجك means to spray the water on your clothes, and you should wash your private part. So this invalidates your wudu. This invalidates your wudu, al-madi, and also al-wadi. Wadi is something, the scholars say this comes with after the urine. When you urinate, at the end, there is something has different color than the urine. It comes usually if you carry something very heavy or during the cold weather. Okay, so it has the same ruling of the urine. طيب. Number 3, النوم المستغرق. Okay, the deep sleep. This is one of the big issues in this chapter, sleeping. Okay, can we say that sleeping is one of the nullifiers of wudu or not? The scholars subhanAllah have different views. The first opinion, that sleeping will not invalidate your wudu. Will not invalidate your wudu. Okay, like some scholars mention this, عن سعيد بن جبير, مكحول, عبيد السلماني, الأوزاعي. They say sleeping will not invalidate your wudu. شلون؟ عجيب. صح؟ If you sleep in the halqa, you sleep in the at home. طيب. They said because we have hadith in Bukhari and Muslim. أقيمت الصلاة والنبي صلى الله عليه وسلم يناجي رجلا فلم يزل يناجيه حتى نام أصحابه ثم جاء فصلى بهم. The Iqamah started. And the Prophet ﷺ was talking to one of the people. And he took time. يعني imagine, the Iqamah finished. He should start the Salah, the Prophet ﷺ. But there was a man talking to him. And it took time. This conversation took time. So the companions, some of the companions slept. So when the Prophet ﷺ came and started the Salah, they started the Salah with him. They did not make wudhu. They do not make wudhu. Another narration in Sahih Muslim. Anas radiallahu ta'ala said, كان أصحاب رسول الله صلى الله عليه وسلم ينامون ثم يصلون ولا يتوضؤون. Anas said, the companions of Rasulullah صلى الله عليه وسلم used to sleep, then they pray without wudu. Then they pray without wudu. Another narration, waiting for the salah, فينعسون. What does it mean ينعسون? يعني when you are waiting? Huh? Noozing. طيب. حتى تخفق رؤوسهم. يعني they are waiting the salah until they reach to a point تخفق رؤوسهم. يعني the head fell down. طيب. Then they stand up for the salah. They stand up for the salah. So they say this hadith mean that there is no need for the wudu when you wake up. Second opinion, sleeping, any kind of sleeping will invalidate your wudu. So you have to make wudu. You have to make wudu. Why? Because there is hadith. The Prophet sallallahu alaihi wasallam says, "Al-aynaan wika'u as-sah, faman nama falyatawadda." The eyes, wika'u as-sah means the eyes like the to tie your anus, the orifice of the opening of the wind, passing the wind. فَمَنْ نَامَ فَلْيَتَوَضَّأ. If you sleep, you should make wudu. It means that when you close your eyes by sleeping, okay, you cannot control yourself. I mean by the wind. So the wind can leave, can come out. So they say, خلاص, this hadith means if you sleep, you should make wudu for the salah. Sorry?
There are so many Jummah, they sleep and they snore.
طيب, this is the second opinion. The third, huh?
Deep sleep, right? Or all?
I'm mixing the opinion and with the hadith. طيب. So the opinion, any kind of sleep will invalidate your wudu. The third opinion, a lot of sleeping, long sleeping will invalidate, the short sleeping will not invalidate your wudu. طيب. They mention hadith, من استحق النوم فقد وجب عليه الوضوء. من استحق النوم, يعني if you sleep in a deep way, then you have to make wudu. And when you sleep deeply, if it takes long time, Number 4, the fourth opinion, your sleeping will not invalidate wudu if you are sitting in a position that you control yourself, in a sitting position. When you sleep in a sitting position. But if you lie down to the right or to the left or on the ground, then this will invalidate your wudu. This will invalidate your wudu. Why? Because they have a hadith, ليس على من نام جالسا وضوء. There is, it is not compulsory to make wudu for the person who sleeps while sitting down. Okay? Until he lies down. Then he will invalidate his wudu. No, this is not authentic hadith. It's not authentic hadith. And there are different opinions, yani, also for other opinions, but these are the famous opinions. طيب. But at the end, yani, the strong opinion, if you sleep in a way that you don't know what is happening to you and what is happening around you, then you have to make wudu. But if you sleep in a way that you control yourself and you know what is going around you, then no need to make wudu. By this way you can join the hadith. Because as we mentioned, there's hadith that the companions were sleeping in the masjid, and when the Prophet ﷺ started the salah, they joined him. Okay, it means they know what is happening around them. They know that the salah started. Okay, but if you sleep, if you close your eyes and you cannot control yourself, or you don't know if there is wind or not, if you passed wind or not, then you have to make wudu. So sometimes, especially when you sleep اللي هو afternoon before Asr. Okay, for example, you come home 2:20 and Asr Adhan 2:40. So you have only 20 minutes. Or the coming days 2:30. So only 10 minutes. Then you like to take rest on the furniture, not on your bed. And the kids playing, shouting, fighting. You can feel what is going. That your son is beating your daughter and they broke the window. You feel what is happening. And your wife shouting. And also she is shouting, the kids shouting you, and you are you feel. In this way, you should not make wudu. You should not make wudu. Why? Because I feel what is happening. I feel the adhan. Still, my feeling with me. But if you sleep in a way, deep sleep, when you start sleeping, when you put your head, okay, you can feel the fighting. But خلاص, when you wake up, no one around you. So it means خلاص, you went to deep sleep. You have to make wudu. Okay, I don't remember the adhan. I slept 2:20 or 2:30, and the adhan 2:40, and now it is 2:50. Yes, the iqamah did not start, but I cannot remember the adhan. So it means خلاص, you went into the deep sleep. You have to make wudu. Okay, some people, subhanallah, they snore. Okay, mashallah, people are different. Okay, different qualities, and mashallah. Some people, mashallah, as if they have on and off. Subhanallah. Huh? I want to sleep. Okay, yalla, ma salama. On. I want to sleep only 20 minutes or 5 minutes. Off, yalla. He wakes up and he goes to work, or mashallah, some people like this. Subhanallah. Very easy to sleep and very easy to wake up.
It's called power naps.
Some people difficult to sleep and difficult to wake up. Some people difficult to sleep but very easy to wake up. Subhanallah, different. If you have an anxiety, it is difficult for you to sleep. Yes, people with an anxiety. Okay, not always, usually. Or if you think a lot. For example, tomorrow you have an exam or operation. So you want to sleep, difficult. Okay, maybe 1-2 hours you are on bed. Okay, you did everything. You recited Surah Al-Zumar, you recited Surah Al-Mulk, you recited Surah Al-Sajda, you recited the Adhkar, you checked your WhatsApp. Okay, everything. But if you sleep, I mean for anxiety, when they sleep, difficult to wake up. Depression, no, the opposite. Depressed people, they sleep, but quickly they wake up. طيب. Yeah, subhanAllah, sometimes it is a disease, sometimes something social, sometimes يعني as a physical, his physical, his chemistry of the body. طيب. So as conclusion, when you sleep and you know what is happening around you, and you know that you passed one, then your sleep will not invalidate your wudu, because I can know what is happening around. But if you sleep in a way that you don't know what is happening around me, then you have to make wudu. You have to make wudu. طيب. Not necessary. For some people, mashallah, they snore and they can know if it is the time of salah. Yes. When they hear the iqamah, خلاص. Or usually in Jum'ah, when they hear the dua, they wake up. خلاص, they know that Ameen, alhamdulillah. Because he's listening to the Imam and he doesn't know. Yani, he doesn't know Arabic. Or he doesn't like the Imam. Okay, or he doesn't like the topic. خلاص, he's waiting the dua. اللهم اغفر للمؤمنين. خلاص, he wake up, Ameen. Alhamdulillah. طيب. So this is called النوم المستغرق, the deep sleeping. نوم مستغرق, very deep. Number 4, زوال العقل. When you become unconscious, this will invalidate your wudu. He says بالسكر أو الإغماء أو الجنون. You are unconscious, you lost your mind because of sukr. السكر means خمر, alcohol or خمر. أو الإغماء. إغماء, what's mean for إغماء? Unconscious. Okay, maybe because of the sun. You know, people fall down because of the sun. Low blood pressure, whatever that is. Okay. أو الجنون. He is crazy. Okay. What is يعني الجنون, يعني for example, you know, a person who has fits, epilepsy. Okay, he is behaving as majnoon. Okay, but not all the time. يعني for subhanallah, some people maybe once a month or something like this, for a few seconds. Epilepsy. Okay, this is a psychological disease. They have to make wudu. Yes, it is a few seconds. It takes only a few seconds, but he has to make wudu, or she has to make wudu. And also, like these points, the anesthesia, the general anesthesia. I mean, they give you anesthesia for operation. Or sometimes, you know, they give people anesthesia for MRI, or for CT scan, or maybe for any kind of treatment for a few minutes. You have to make wudu. You have to make wudu. طيب. This number 4. Number 5. مس الفرج بلا حائل سواء بشهوة أو بدونها. Touching the private part directly. They say بلا حائل. What does it mean بلا حائل? يعني skin to skin. Not on, there is a barrier. No, skin to skin. Okay. بشهوة or without shahwa. With a desire, with a lust, or without. Also, this point has different opinions. The first one, touching your private part will invalidate your wudu. In any case, you intend to touch without intention, with desire, without desire, you have to repeat your wudu. You have to repeat your wudu. Why? Because there is hadith, the Prophet ﷺ says, "Man massa dhakarahu falyatawadda." The one who touches his private part, he should make wudu. من مس ذكره فليتوضأ. Okay, of course this is for the man and women. Huh? Yes. Intentionally, not intentionally, you have to make wudu. You have to make new wudu for the salah, of course. Okay, so this is the first opinion.
So what if the mothers are nursing their children?
Inshallah. The second opinion, I'm talking in details. I'm trying to talk in details. Okay, يعني, inshallah, it will be beneficial, and also to know the opinions. The second opinion, that touching the private part will not invalidate your wudu. Intentionally, without intention, with desire, without desire, it will not invalidate your wudu. Why? Because they use the hadith. The Prophet ﷺ said to a man asked the Prophet ﷺ, and the Prophet ﷺ said, وَهَلْ هُوَ إِلَّا بَضْعَةٌ مِنْكَ? It is part of your body. يعني when a man asks him, should I repeat the wudu or not? The Prophet ﷺ, it is one of your parts of you, يعني, one of your organs. يعني. Like he means ﷺ, it is like touching your arm or your head or your thigh. So when you touch your private part, it's okay. No need for the wudu. So the second opinion, they said, this will not invalidate your wudu in any way. This is madhab the first opinion is madhab Imam Malik, والشافعي وأحمد, and most of the companions. And the second, this is by Imam Abu Hanifa, rahimahullah, and also some of the companions. Third opinion, ينقض إذا كان مس الذكر بشهوة. If you touch your private part with lust, with desire, then this will invalidate your wudu. But without lust, without desire, then it is no need for wudu. Yeah, for example, you are applying a medicine. You wear, maybe you have حساسية, you have some eczema, and you are scratching, itching. Okay, this will not invalidate. So this is the third opinion. This is the third opinion. It is a saying from an opinion from Imam Malik. Imam Malik has different opinions or different narrations about this subject. The fourth opinion, they say it is mustahab. It is recommended to make wudu, not wajib. It is mustahab, not wajib. And this is one of the opinions of Imam Ahmed. Imam Ahmed has different opinions about this, and one of them that it is mustahab. And also this is the opinion of Shaykh Islam Ibn Taymiyyah. This is the opinion of Shaykh Islam Ibn Taymiyyah. And also they mention this the opinion of Shaykh bin Uthaymeen rahimahullah. The fourth, okay, now the first opinion and second opinion clear from the hadith. But now what is the view of the third and fourth? The third opinion which says that if you touch intentionally with lust, with desire, you have to make wudu. They say because the hadith, the Prophet ﷺ said, "Man massa dhakarahu falyatawadda." The one who touches his private part, he should make wudu. And the other hadith, okay, Shaykh Ahmed said both of the hadith authentic. Yes, some scholars said the first hadith is authentic and the first is authentic, the second not authentic. Other scholars said no, the second is authentic and the first not authentic. Shaykh Al-Bani said both of them authentic. Also Shaykh bin Uthaymeen, both of them authentic. طيب. But the first one, طيب, من مس ذكره فليتوضأ. If you touch intentionally, you have to make wudu. Why? Because the second hadith, okay, وهل هو إلا بضعة منك? يعني it means the Prophet ﷺ, no need for the wudu because you are touching it without intention. Without intention. Okay? So they said no need for the wudu. The fourth opinion, they say they want to join both of the hadith in a different way by saying that there is hadith, the Prophet ﷺ said, do wudu. The second hadith, it's okay. So as if it is not wajib, but it is mustahab. It is not wajib, it is mustahab. طيب, يعني maybe the third opinion is safe opinion that intentionally يعني with lust and desire when you touch you do the wudu but without desire without for example you have itching you have eczema طيب you want to apply medicine okay no need for the wudu no need for wudu or يعني for example I am in the toilet I take shower or something then you touch you wash no need for the wudu no need for the wudu so the third opinion is يعني strong opinion. This is, as we mentioned, this is the opinion of Imam Malik and also Al-Albani, rahimahullah. And also this is the second opinion of Shaykh Ahmed AlRumh. Okay, yes, at the beginning Shaykh Ahmed AlRumh was saying the same thing like Shaykh Islam Ibn Taymiyyah. Then he changed his opinion, Shaykh Ahmed AlRumh, and he said, no, you have to make wudu if it is intentionally with lust. It means, intentionally it means with lust and desire. But if it is without lust, without desire, then no need for the wudu. Then no need for the wudu. Yes. Sorry? Sorry? Who said this? It will not invalidate the wudu above the clothes. We are talking about direct. We are talking, I mentioned from the beginning, this is skin to skin, without barrier, yes. If there is barrier, no problem. We will not invalidate your wudu.
Someone has an opinion like with the barrier.
I don't know. I don't know. I don't know. I did not read anything. Did you read anything like this? Pakistan? Here in Kuwait? I don't know. I don't know. No, these four opinions I mentioned, this is about the direct touch. طيب. What about the woman? Okay, the woman, the same thing. The woman, the same thing. Why? Because there is narration, من مس ذكره. What does it mean, the ذكره? It means the penis. There is another narration, من مس فرجه. فرجه means it is more general, private part. So also the same thing, the woman. The same thing, the woman. طيب. What about touching the other's private part? Okay, maybe you are a doctor. Maybe you are a mother washing your kid. طيب. This will not invalidate the wudu. This will not invalidate the wudu. Why? Because the hadith talks about yourself. من مس ذكره. من مس فرجه. It doesn't talk about the others. So يعني if you are washing your baby, are you doing this or not? Yes. But you are doing this, huh? You did this. Not shame? It is shame. صح? It is shame that the man, the father, he changed the diaper for his kids. This is the job of the woman. Huh? But you are a man, شلون ما يصير. But we don't have, yes, كان يخصف نعله يرقع ثوب. Yes, the Prophet ﷺ was helping, but يعني for to repair his shoes, to also to maintain his dress, but not to wash his kids. Do you have a hadith like this?
Wash the dishes.
Okay, but to wash your kids, huh?
Our kids also.
This is not your job.
Still, if you have twins, triplets, one mother cannot do it.
Okay, this is an exception, but you don't have twins. Do you have twins? You don't have twins, huh?
Cooking is not the job of women, they will say.
I want to come out. This is their right.
No, Adi is like, then what you
No, if, يعني for example, your baby, okay, needs to change. Okay, don't touch him. I'm joking. Well, no. One time I remember in the hospital, I can't remember exactly who was sick, my wife or my I think my wife, she was sick. And at that time, maybe I don't have a maid. So I brought my wife with me and with my kid in the hospital because I'm working in the hospital. So my wife with the doctor and my son was with me. And I changed the pampers for him. So one of my friends said, "What you are doing?" I said, "I changed it." "You change for yours?" "Yes." "I see shame, عيب." "What is this?" What is the problem يعني? Okay. Wallah, he was talking seriously. He's not joking with me. Seriously, wallah, some people, inshallah, not some people, few, very few, inshallah, yani. Okay, with this mentality. This is the job of your wife. You don't touch them. When they are clean, you touch them. But like this, wallah, some people like this, subhanallah. Some people like this. This mentality, from where I don't know, wallah. I don't know from where this mentality. I don't change. Okay, but she's sick. Even when she's sick, she has to do this job. This is not the job of the man. Okay, from where? From the Quran, from the Sunnah? No. From his father. And his father from his grandfather. This kind of jahiliyyah. Subhanallah. Well, he's talking seriously. Seriously. Some people like this mentality. This is the job of the man. You don't touch them. Khalas. Khalas. When I take care, when he is, for example, 7, 8 years old, khalas, I take care, I take him with me to the Duwaniyah, to this. Subhanallah. So, inshallah, no problem. You change for your kid and come to the salah. Okay? But for example, if you are in trouble, tell your wife the opinion that if you touch, I have to make wudu, but I'm going to the masjid. So please, you change for him. Huh? Take this opinion. Huh? Let's check this opinion. يعني, okay, Malik al-Shafi'i, they say you have to make wudu. Malik al-Shafi'i, you have to make this wudu. Sorry. كذاك مثل المرأة أو الرجل اللي ذكر الصبي ونحن لا ينقض. Sorry. مالك والزهري والأوزاعي. This will not invalidate the wudu. Okay? But يعني the others, like Abu Hanifa, Shafi'i, you have to make wudu. If you touch for the others.
It invalidates for both?
We are talking about the kid. The kid, no wudu for him.
If the doctor touches an adult.
No, not for both. Not for both. For the one who is touching. For example, if there is an adult, he is sick, and the doctor, okay, checking him, okay, this will according to this will invalidate only the doctor, not the patient. Yes.
Doctors wear gloves.
Allah, some of them without. You are laughing? Yes, this is fact. This is fact. Because I went in the hospitals. I saw this. Subhanallah. You are laughing, you think this is, you believe this is strange. Okay? But for those who are practicing this every day, khalas. The first day, the first month, the first year, yes, I'm using the gloves. But khalas. Why to waste? Yalla, next patient, yalla. No time for the gloves. They don't care. Wallahi, yani many of them, they don't care about the hygiene. Do you think that the doctors follow the rules? They don't. They know the rules, but they don't follow the rules. Of course, I don't mean all of them. I don't mean them. They don't. Okay, they don't follow the rules. Khalas. I'm experienced. I'm working for 30 years. You want me to wash? Alhamdulillah. Okay. This doesn't mean that the bacteria will not go from. And sometimes the problem not with you, the problem with the other patients. And this is also common, or this can happen. When the staff, I mean the medical staff, don't follow the rules of hygiene, they can cause problems for the patients, especially the nurse. Yes, because you know the nurse, and every morning they go from one patient to another patient. They check the vital signs. the heart rate, the blood pressure. Okay, then they go to the next patient. So suppose the first patient has a problem. Okay, bacteria or something. Then they will transport this bacteria from one patient to another patient. And this is very dangerous. Suppose he has a difficult disease, so it is spread to all the patients. Or for the patients who have weak immunity. Because of what? Because they don't follow the rules. Why should I change the gloves? Why should I wash my hands after every patient? This is for their benefit and for your benefit. They don't follow the rules, subhanallah. Of course, not all of them, not all of them. طيب. What about touching the back? I mean the exit of the stool. This is not called farj. Farj means the private part, the private part, the front side. But the back will not invalidate the wudu, will not invalidate the wudu. Number six, أكل لحم الإبل. أكل لحم الإبل. This will be the last point, inshallah. أكل لحم الإبل. Eating the meat of camel. Or sometimes they write jazur. Jazur also, this is one of the names of the camels. Majority of scholars, okay, first opinion, majority of scholars say this will not invalidate. This will not invalidate. Okay, and madhab Imam Ahmed, it invalidates your wudu. Madhab Imam Ahmed, it invalidates the wudu. So majority of scholars, Ahnaf, Malikiya, Shafi'iyya, it's okay. You eat the camel meat and no problem. No need for the wudu. While Imam Ahmed says, no, you have to make wudu. You have to make wudu. Sorry? Okay, I mentioned this. The first opinion, the majority of scholars, they say, because the Prophet they mention hadith that كان آخر الأمرين ترك الوضوء ممن مست النار. Okay, there is an issue called there is an issue which is that if you eat anything cooked by fire, you have to make wudu. At the beginning, okay, of Islam, if you eat anything, yes, cooked by fire, you have to make wudu. Okay, then there is they say there is hadith. The Prophet they mentioned the companions. كان آخر الأمرين, the last thing was no need to make wudu if you eat something touched by fire. So they said this ruling includes the camel meat and the cow meat and the sheep meat, any kind of meat. So this is the opinion and this is the view of majority of scholars. While Imam Ahmed said, no, this hadith is a general hadith. It is not specific about the camel meat, about anything. About the meat, about the vegetables, about sometimes we use we like the grilled onion or tomato, صح? Also, if you eat it, you have to make wudu. So the second or the last ruling was it's okay, you can eat without wudu. But there is an exception for the camel meat. Why? Because there is hadith. The Prophet ﷺ said, "توضأوا من لحوم الإبل ولا توضأوا من لحوم الغنم." Make wudu after eating a camel meat, not after eating a sheep meat. Okay, this is hadith, and this hadith Abu Dawud. Another hadith in Sahih Muslim. A man asked the Prophet ﷺ, "O Rasulullah, should we make wudu after eating a meat of a sheep?" He said, "If you like, in shit." What does it mean, shit? If you will, if you like. Okay? If you like, make wudu. If you don't like, don't make wudu. So it means it is mustahab. For example, now if we eat tikka, okay, make wudu. Mustahab, not wajib. Then the man asked another question. أنا أتوضأ من لحوم الإبل, should we make wudu after eating a camel meat? He said, yes. make wudu after eating camel meat. So Imam Ahmad said this is a clear hadith, and this is a specific hadith. It is not a general hadith. So this makes the opinion of Imam Ahmad stronger, okay, in this issue. It makes it stronger, and this issue. So we tell you, make wudu after eating camel meat. Of course, if you are going to pray. Yani, subhanallah. An-Nawawi is one of the scholars of which madhab? Shafi'i. طيب. An-Nawawi said about the madhab of Imam Ahmad, he said, وَهَذَا الْمَذْهَبْ أَقْوَى دَلِيلًا وَإِنْ كَانَ الْجُمْهُورُ عَلَى خِلَافِهِ. Nawawi rahimahullah, he's Shafi'i. Then he's discussing this issue. Then he mentioned the opinion of Imam Ahmad that you have to make it. He said, and this opinion is stronger, or this opinion has a stronger proof. Even the majority of scholars are against. So this is the way of the scholars, like Nawawi, Ibn Hajar, Ibn Taymiyyah. Okay, يعني Nawawi Shafi'i, Ibn Taymiyyah Hanbali, طيب, Dhahabi Shafi'i. Okay, but they follow the proof. For example, Ibn Abd al-Barr Maliki, they follow the proof, the evidence. Okay, if the proof is clear, authentic, I'll follow the proof. I will not follow my Imam. The Muslim should be in this way. Yeah, this is Nawawi Shafi'i, but he took the opinion of Imam Ahmad. Why? Because he said, I believe the evidence is stronger here. So if you eat a camel meat, make wudu for the salah. Okay, be careful. Sometimes the shawarma. I went to Aswaq al-Grain. You know al-Grain, the shops. Okay, Lulu, Hyper, and these. Okay. There is a restaurant. They sell shawarma. I think only shawarma. Okay. I thought, what kind of shawarma? He said, or I asked him, what is special do you have? He said, we have a camel meat shawarma. Wallah, yalla, let's try. It was nice. طيب. But it was after Isha Salah, alhamdulillah. After Isha Salah. طيب.
Was nice?
Huh?
Nicer than the other one?
Yes, nice, wallah. Maybe we can order now, if it is open. Okay, there is an issue related this point. Yani, some people don't like to inform. Yani, if you have guests, they don't like to tell them. Yeah, maybe I'm not sure. But maybe if I tell you that this meat is a camel meat, maybe some of you will not eat. Okay, I should inform you, especially if it is lunch. The lunch is 2 p.m. or 2:30, and people will go to the masjid after the lunch. So I have to inform you. That this is a camel meat. Okay? Yeah, some people don't. Well, I know some people. They invited us for lunch, and they did not tell us that this is a camel meat. Huh? I think later I came to know that this is a camel meat. I repeated my salah. I think like this was, or they told us after we finished the food. طيب, Habibi, this is not a joke. It should not be. You have not take this topic issue as a fun. This is salah. Or maybe you don't believe that this will not invalidate the wudu, but I believe it will invalidate my wudu. I have to make wudu for the salah. Don't joke with me about the salah, about the ibadah. So please, if you bring tikka here, tell me this is camel meat or not, huh? جزاكم الله خير.
Send us the location for that camel shawarma.
near Aswaq al-Grain, you know. Now Aswaq al-Grain, a lot of shops. Inshallah, خلاص, for Tuesday.
We should also tell the guests this is camel meat and be careful, you have to make wudu after you eat, because maybe they don't know this.
Yes, tell them hadith. Tell them the hadith. Okay, tell them this is a camel meat, and the Prophet ﷺ told us to make wudu after eating camel meat. Okay. جزاكم الله خير. صلى الله عليه وسلم محمد.